Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health. We're going live today. We're going to talk about bicep tendinitis. Before we get into our topic today, a couple things. One, if you haven't done so already, take a second, pick up my new book. It's called A Fitness Carol. It's available on Amazon, or you can go to afitnesscarol.com. And also, we're less than 2 weeks away from the push-up marathon, where I'm going to be attempting to break the Guinness World Record for push-ups in both 8 and 12 hours. It's on May 25th from 8 a.m. to 8 p.m. Eastern Standard Time. We're live streaming the whole 12 hours on my YouTube channel. It's a fundraiser. All the money and proceeds are going to Cape Ann Animal Aid, which is this awesome animal shelter in Gloucester, Massachusetts. So I hope you all can tune in to the event on May 25th. It's a Wednesday morning. Tune in, see how we're doing. Hopefully, we'll break this those two Guinness records, and also it'd be great if everyone could just make a small donation to Cape Ann Animal Aid. Like I said, they're a great organization. Okay, all right, great. So today we're talking bicep tendinitis. So weightlifting, common injury. I've been a chiropractor for over 31 years. It's a common weightlifting injury. A lot of it has to do with people who either are entering the office with what we call like anterior or front shoulder pain, or they have pain down in the crease of the elbow. So we're going to talk a little bit about why that's happening, and then we'll discuss some ways that you can help fix it. So why do weightlifters and athletes develop bicep tendinitis? Well, first of all, you have to understand the anatomy of the bicep a little bit. The top of the bicep actually breaks up into sections, or there's two sections of the bicep. There's what we call a long head and a short head. The long head of the bicep comes all the way up the shoulder here. There's actually the tendon of the long head is so long that there's actually like a groove in your humerus or arm bone for that tendon to kind of groove into, so that doesn't go all over the place. And then the tendon attaches into the scapula or your shoulder blade. And then the short head comes up and also has an attachment on the scapula. A lot of people don't realize that both heads of the bicep attach to the shoulder blade. Then it comes down, and of course, it attaches below the elbow so that it assists in not only flexing the elbow, but it actually does what we call supinate. It turns the hand from this position to that position. So it flexes and supinates. That's why a lot of times when people talk to you about, hey, when you're doing dumbbell curls, make sure that not only do you curl the weight up, but you also come up and turn the wrist facing the ceiling so that you get a full contraction of the bicep. So knowing that, why do we run into a lot of problems with bicep tendinitis? What I find the main cause for bicep tendinitis is tightness in other muscles. So when you enter a gym and you're going to work out, you're doing bicep curls, you're going to grab a bar. We have to be in a fully supinated position when you grab a bar, or when we hang from a bar. If we want to do chin ups, we're fully supinated. The problem is a lot of people are very tight in pronation. Their shoulders are internally rotated. Their forearms tend to be internally rotated, like pronated, and that's because we do a lot of things in front of us. We're at our computer and our hands are like this all the time. We're driving a car. We're kind of a pronated society. We're always internally rotated this way because we're always forward, and our hands are always this way. A good way, just check it out, is just take your hands right now and just kind of try to turn them out like in a supinated position, and you're going to find that what's more comfortable. Is it easy to just kind of flop them this way, or turn them out this way? I don't know about you, but when I do this, it's like an effort for me to fully supinate my hands. And it's because of the fact that there's a lot of big muscles that keep the shoulder internally rotated. The pec muscles, the muscles of the chest internally rotate the shoulder. Who has tight pec muscles? Weightlifters. Their muscles are always tight. It pulls the shoulder internally rotated. The latissimus dorsi, the big back muscles, they're internal rotators of the shoulders. So we have these large muscles that we work on all the time, with weightlifting exercises. They get tight. They keep the shoulders internally rotated. Then you have a small muscle down here called your pronator teres. This muscle, a lot of people, is very tight, and that keeps and it gets tight because we're doing things always in this position at the computer. And when this muscle gets tight, it keeps the forearm in this pronated position. So we're kind of stuck in this like pronated, internally rotated position. We go to the gym, we grab the bar, we hang from the bar, we're putting a lot of stress on the tendons of the bicep. We're basically forcing the shoulders and arms into this position when we're kind of stuck in this position. And if when you go from, usually people go to the gym right from their office or right out of a classroom. You don't warm up properly. You irritate the tendons. You end up with bicep tendonitis. There's in two places. You're either going to get it down here or you're going to feel it in one of those two bicep tendons up there. So what do we need to do? Couple things. Well, one is we got to loosen up that pronator teres muscle. If I would recommend it, just kind of Google that muscle, pronator teres, get a visual on it. Being a live stream here, I can't throw up any anatomy, but it's a muscle that comes um, across the elbow area. It actually crosses the elbow joint and it rotates this way. We have to do some fascia release on that muscle and through there. Um, Good way to get in there is to you can just take your thumb and put it right across that area here and just do some supinating type of turns with the forearm and kind of get a release on there. I go into more detail on this. We have a video on our channel. It's actually, I think it's one of our most viewed videos. So when you go to the channel, it's probably one of the first that pops up, but it's on bicep tendinitis. And we go in detail into regards on how to release that pronator teres muscle. Other thing we need to do, we got to get those shoulders out of internal rotation. So a couple important things to do on that is we got to release the pec major. We got to loosen up the pec major. Once again, we have videos on fascia release of the pec minor, pec major, stretches for the pec major, pec minor. But you got to get those muscles of the chest loosened up. They're pulling everything forward. And then, of course, the other muscles, like we mentioned, like the latissimus dorsi, just posted a video a couple days ago on fascia release techniques for the latissimus dorsi. So all those muscles have to be released. They don't, when you're doing fascia release work, it takes time. It isn't something that's going to happen overnight. So if you have kind of like those tight internally rotated shoulders and you feel tight with the wrist going in this direction, give it some time. Start working on it every day. Spend 3, 4, 5, 6 weeks on it, trying to loosen this up and make sure that before you enter the gym, you warm up properly before you do your bicep work. Like I said, it's something that people kind of, rush into the gym a lot of times without warming up properly. People may do some chest work that actually makes you tight to begin with. You do the chest exercises, your chest is kind of all pumped up, it's all tight, it's pulling this way, and then you may do chest and biceps, which is kind of a common combination. Now you go over, you grab the bar, you're forcing that position, you're putting stress into the tendons, and before you know it, you're going to start to develop bicep tendonitis. So anyways, take some time, do some fascia release work, check out some of the videos that we have here on how to release some of these muscles that we talked about. Warm up properly when you go to the gym. Don't rush to get your workout in. You want to make sure you're warmed up properly, especially if you're someone that's susceptible to bicep tendonitis. Okay. Let me see if we have any questions to answer today. I don't think I see any. Do you see?
No, I don't
Yeah.
see any questions.
Okay, so we're gonna wrap this up. So just a quick talk on bicep tendonitis today. We'll have this video up on our channel. We'll be back next Saturday, same time, 4 p.m. Eastern Standard Time. And then on the 25th, like I said, 8 a.m. to 8 p.m. Eastern Standard Time, we're live streaming Guinness World Record push-up attempt for Capian Animal Aid. All right. So until then, OcraMed Health, we're here to keep you fit forever.